Hello everyone, my name is Sarah Ross and this is my Capstone project presentation for my University Studies degree program at Northern Arizona University. To begin with, I would like to present my thesis question, then give you a brief description of why I chose this area for my interdisciplinary research. My thesis question is, how can improved mental health supports in American public schools make students and teachers better? I have decided to concentrate on mental health supports in public schools that use a PBIS or Positive Behavior Intervention Support framework, which I will discuss in detail shortly. I wanted to start this presentation with a little bit of information about myself. I am a returning college student. I started at NAU over 20 years ago with an elementary education major. I never completed that major. My husband and I started a family, and I was a stay-at-home mom for over 20 years. Since I currently work in a public elementary school as a reading intervention teacher, I thought that psychology and learning/pedagogy would be a good fit for my university studies degree. I have also had some experience with the PBIS model, and I wanted to find out a little bit more about mental health supports in regards to the PBIS framework. What is school-wide positive behavior intervention and supports? This system was founded in 1998, and it is a universal school-wide system that is used in over 7,500 schools across America. It is used to reduce behavior problems in students by implementing positive behavioral, social, and emotional strategies. PBIS is a three-tiered system. In Tier 1, or the primary level, there are prevention strategies that are put in place for the entire school population. At this level, all students are made aware of behavior expectations in every area of the school, including hallways, playgrounds, and buses. An example of this is positive signage that lets students know what is expected of them. For students who need more support, which is approximately 15% of the student population, Tier 2 or secondary level supports are implemented. An example of Tier 2 supports would be check-in, check-out system, where a student earns points for good behavior and checks in and out with a teacher every day. Then they would have their check-in, check-out sheet signed by a parent. Tier 3, or tertiary level, is used for students that are highly disruptive, dangerous, or showing behavior that impedes their social or academic growth. In a 5-year comprehensive study of 37 elementary schools in the state of Maryland who use the PBIS model, researchers found significant decreases in suspensions and referrals for Tier 1 level problems and students, and the frequency and severity of Tier 2 problems were reduced. And as a side note, teachers also felt more competent in carrying out the PBIS framework after having received training. As part of this large-scale survey, staff completed a 37-item report concerning organizational health annually. As noted on the graphs, teachers reported higher levels of organizational health. Resource influence, which is principals' ability to lobby for resources for their school. Staff affiliation, which is warm and positive interactions with colleagues. And academic emphasis, which is where students are cooperative in classrooms and driven to improve their skills when using a PBIS framework versus a non-PBIS framework school. Similar results have been found in large-scale studies about the PBIS system. How can public schools meet the mental health needs of all of their students, especially those students in the Tier 2 and Tier 3 intervention levels that may not necessarily have access to mental health supports outside of school? Oftentimes, there is a direct correlation between behavior problems and mental health issues. According to a survey from UCLA, 12 to 22% of all youth under the age of 18 are in need of services for emotional, mental, or behavioral problems. Incredibly, 1 to 5% of students with the most severe behavior problems account for approximately 50% of the behavioral incidents handled by school staff. What is school-based mental health? I found several common definitions for the term school-based mental health, which includes services such as testing and assessment, mental health education, collaboration, and wraparound supports, and counseling for individuals, groups, and families. In a one-year pilot program that implemented PBIS and school mental health services, which included family and individual counseling at and near the school, summer camps, and after-school programs, the researchers found students had great success in areas such as increases in social emotional knowledge, risky behavior education, and beliefs about their problem behaviors decreasing. The teachers in this study also had much improvement in many areas. This research was conducted on a small scale, but it proves that PBIS and school mental health services can work well together and be of great benefit to the schools and communities it is implemented in. In my research, I wanted to find out what current public initiatives are in place to support mental health in public schools. What's interesting is I found that there are many initiatives and acts dealing with children's mental health in the United States. These include Individuals with Disabilities Education Act of 1976, the No Child Left Behind Law of 2002, the New Freedom Commission on Mental Health from 2003, and also the Department of Education has a huge stake in children's mental health because it is concerned with their academic achievement. Results from a 2000 School Health Policies and Programs study found there are already many personnel, school-based mental health centers, and connections with professional agencies in place. For example, 77% of schools have a part or full-time guidance counselor who provides mental health services, and 59% of school districts have arrangements with professional mental health personnel or agencies to supply mental and social services to their schools. Why then isn't PBIS and SMH implemented in more public schools in America? I found 5 recommendations in order to implement PBIS and SMH in more public schools successfully. Number 1, funding. There is a definite lack of funding from the public and private sector. Number 2, training for school districts and school staff, which also falls under the funding umbrella. Number 3, common language between organizations. Number 4, community involvement and community health partners working with school districts directly. And number 5, and also important, parents as partners. Because parents are children's first teachers, they play an important role in their behavioral, social, and emotional needs and development. I hope my presentation gave you a clear understanding of my interdisciplinary research intent. If you're still interested in finding out more about the PBIS system, I would recommend you visiting pbis.org. Thank you.